and new technologies are influencing both clinical practice and also the consumer and patient education. Up until now, new media, of course, was internet-based, and now you can go on YouTube and get I met a doctor last night who said he gets and disseminates his clinical information over YouTube.
Today's 25-year-old will be, tomorrow's 65-year-old who is experiencing cancer care in a different way. And I think that what's happening is that it's a twofold sort of issue, is that internet and media is making us much more informed consumers, and it's enabling us to be able to come in and speak to our doctors in a whole new way, which is great. At the same time, it's also making us just knowledgeable enough to be dangerous. Just because you go on YouTube and hear about some things doesn't necessarily mean it's based in actual evidence-based clinical trials. And the problem is then, of course, that sort of hinders what's happening again, is because people go to their doctors and say, somebody online told me that I should be asking you for this. And the doctor is like, I'm not sure. But what that also means, though, is that is a demographic. As we all age, there is, for example, you compare myself to my mother, who doesn't want to put anything online, no personal information, no, versus me, who is perfectly comfortable with all my information online. There are some very different sort of biases and thoughts about how we're sharing our personal information. And there's different comfort levels based on generation, socioeconomic levels. Some people don't have access to those kinds of things, and so it's very foreign to them.
There's a significant penetration of cell phones and smartphones in the market that really defies a lot of the socioeconomic divide that exists around computers. So we're going to need to be thinking about how do we begin to distribute information and education through those kinds of channels. And what is the next channel going to be after smartphones? And we need to be thinking in the futuristic way like that. But for now, the more that we can do to begin to migrate content and to migrate the resources that we've got in that direction, we really will be able to make a difference and reach more of our constituents, the people who we want to help address cancer.
And I have to share with you something that's happened to me in the last 24 hours, which I think relates a bit to the advances that we've made, is in the last 24 hours I've had 3 emails from patients to me and to their doctors saying, you're both in the same place and you have to meet each other. One's from California, one's from Minnesota, and one's from New York. And I've known all of the patients for all of my life, and I've known the doctors' names for a long period of time. And here we are, and each doctor emailed me back and said, we've got to get together. So we now have appointments. So I say that because in a way, we're advancing. I think what the theme here is, we're going to always be dealing with people, with relationships, and how we communicate.
I think that most of us probably email with our doctors, and we're talking a lot about opening those lines of communication and lots of sources. But one thing that strikes me is that doctors are not reimbursed for that time. And so when they do it, it's lovely, but they have no way to code that. And so we're talking about moving forward and that the iPad will be passé in 5 years. But the billing community certainly hasn't caught up with where we are now. And that's something that we do need to fix if we want patients to have that line of communication.
Striking me is that we can't underestimate the challenge of dealing with the misinformation, and that the viral nature of that is, I think, probably a challenge for all of us, and certainly I'm sure for healthcare providers, that you get one piece of misinformation about the best test or the latest, greatest advancement, and it is all over the world before you know it, and people are, calling your office or storming your door and demanding this. And so I think as advocacy organizations, we need to be vigilant about making sure that we're kind of self-policing those disreputable sites that are either forwarding emails or perhaps not even legitimate sites having information and available to people.
I don't think it's just the disreputable information that we have to worry about, but even the newest research results that come out, and then people are like, I want to get that PrEP inhibitor tomorrow.
Right.
Well, see, it hasn't quite been all the way developed yet, and so we do have to be a little bit cautious about what we do as advocacy organizations and how we present new data.
Don't you all worry about too much information? I mean, I certainly feel that myself, this bombardment of information and how you separate out and figure out what you should pay attention to. And I think for a person who's trying to understand his or her diagnosis, his or her treatment, just this bombardment and all these different forces, and how do you figure that out? Again, as advocacy organizations, I think we can try and help people figure that out and try and prioritize it. But it's only going to get to be more and more and more. It's a real challenge for people. It goes from, the extreme when nobody had any information to now, everybody's got everything.
I think we're kind of victims of our own success in this area. We've earned reputations, all of us as advocacy organizations, for having quality information and people can rely on our information. And that, I think, has really paralyzed many of us, including my own organization, for many years in terms of getting into some of these forums. For instance, ACOR, I think, is one of the few places where they've solved the problem of self-policing, and you have really interactive dialogue, and that's why there are 70,000 plus people there. But what's happening now, I think, with a lot of the new forums, the Twitters and the Facebooks and the blogs, is we're not running those. And that's why there are so many all over the place, and there's so many problems with quality. If we can't jump over that threshold and get in there, then people that really don't have the skills or necessarily the values that we have are going to fill that vacuum as they are today. So I think that it's going to take some risk-taking and courage on our parts as organizations to realize the potential of these forums.
There was a really interesting session yesterday on electronic health records and sort of the standards and requirements really geared towards physicians. And interestingly, sort of with the absolute best timing, yesterday there was the release of a new Institute of Medicine report on the Foundation for Evidence-Driven Practice looking at health IT. They talked about health IT as being the basis for a learning health system, and that there is this sort of cycle in terms of practice, research, learning, all in a continuous cycle, and that health IT underpins all of that. And I thought the quote from one of the speakers at the session was really interesting. He talked about health IT as being the circulatory system for value and reform. So I would encourage you to take a look at that Institute of Medicine report. I think sounds like there was a lot of really interesting information about kind of where health IT is going, or at least what the Institute of Medicine thinks that the role of health IT will be in our health system in terms of both research and patient care.
I think that we're looking to the internet to provide good quality information. But beyond information, I think that support is also critical. Of course, the ACOR, Komen, and other discussion lists have been doing that for 15 years and have done really a tremendous job in empowering patients.
Diane mentioned the 2007 Institute of Medicine report, Cancer Care for the Whole Patient, which says that all patients should be screened for psychosocial needs. All patients should have access to psychosocial care, so we should be either providing those services or referring for those services, and all patients should have follow-on care. And I actually believe that it's going to be through technology that we're going to help bridge that gap.